call the meeting of the Human Services Committee to order. Karen, please call the roll.
Chair Swarzy.
Here.
Member Childress. Member Garcia.
Here.
Member Desart.
Here.
Member Galassi.
Here.
Member LaPlante.
Here.
Thank you very much. Do we have any public comments?
No public comment.
Okay. With regards to my remarks, you all may have seen the email news release regarding our DuPage Care Center again. Another recognition. I'm going to read some excerpts from the press release. So the DuPage Care Center received another prestigious recognition when it was named one of the 2024 U.S. News Best Nursing Homes by U.S. News and World Report. The Care Center is listed as high performing for both short-term rehabilitation and long-term care, making it one of just 3% of nursing homes nationwide to receive both designations. To be recognized as one of the 2024 U.S. News Best Nursing Homes, a home must have been high performing in short rehabilitation, long-term care, or both. Only 19% of more than the 15,000 skilled nursing facilities rated by U.S. News meet the standard. The short-term ratings are based on an assessment of 10 quality measures, including staffing levels, medical outcomes, and residents' complaints. Similarly, the long-term ratings are based on an assessment of 9 quality measures, again, including staffing, medical outcomes, resident complaints, vaccinations, and appropriate use of medications. Last month, as you all may remember, Newsweek magazine ranked the DuPage Care Center as the 3rd best nursing home in Illinois, based on performance data, peer recommendations, management of the COVID situation, and accreditations from the Joint Commission and Commission on Accreditation of Rehabilitation Facilities. So again, congratulations to Janelle, are you there?
I'm here.
Would you like to comment at all on it?
You know, we had a family committee meeting for the first time. Excuse me, let me get my camera to stay. We had a family committee meeting for the first time, bringing a new group of family committee members together. And what I said to them is, it's one thing to get to these 5-star ratings and these achievements. It's much harder to stay. We will never be perfect. I think our goal is to just continue with process improvement. And that's the best that we can do. So it's much harder to stay where we are, but thank you very much for your comments.
Great job. Great job to you and your staff. Please pass that on from this committee.
We will.
Thank you. Okay, I will take a motion to approve the minutes from our last meeting of November 7th, item 233742.
Second.
Motion a second. Questions or comments? All in favor say aye.
Aye.
Opposed? Okay. Now the fun part of our meeting, we get to recognize Jeannie Mochio. Did I pronounce that right? So Mary, I'll have you come up.
So, Natasha, yes. Today we're recognizing Jeannie Mochio for 30 years with the county. At 30 years, Jeannie did have the opportunity to get recognized in front of the board, but she wanted the cozy, intimate setting of the.
I went to the board at 25.
She found that a little too intimate. So, you know, as always, when we have somebody from seniors recognized, we get a big turnout, really sort of emphasizing that real team atmosphere in the seniors division. So Jeannie is the manager of our Choices for Care unit. Choices for Care has caseworkers, case managers in all of the hospitals, as well as case managers who work in community settings in the long-term care facilities. Jeannie is just such a pleasure to have around the office. She's been here longer than I have, which is, I feel like I've been here a long time.
I know.
So I'm going to turn it over to Natasha to say a little more.
So Jeannie's been with seniors for 27 years. She originally started with the Care Center. She worked there for 3 years and then came over to seniors. She started in CCP and did some APS, and then did, she and I job shared for 8 years in the Ombudsman program. And then for the last 7, she's been with the Choices for Care program. So we are really excited to have Jeannie. She's a really great manager, really takes care of her staff, and works very closely with the Department on Aging. Whenever they have a question about the Choices for Care program, they reach out to Jeannie. She's also helping them put together their new data entry system. So we are very excited that she's at 30 years. So.
I do want to say one more thing about sort of the complexity of Jeannie's position, because she has staff in every hospital. Each hospital has its own processes and procedures, different credentialing, different, requirements for health screenings, those kinds of things. So she's really had to navigate some really significant challenges, just kind of making sure our internal policies and HR practices can, work in combination with the hospital. So I really want to commend her for that work.
Thanks, thank you. I was driving here this morning and I was thinking, I cannot believe it's been 30 years that I've been driving here. But I was in a job share for a total of 17 years. So I was able to, be at home a lot with my boys, which was wonderful. But when our oldest was finally going to college, my husband said, "Are you gonna go full time?" Darn husband. But I love, obviously I love the county. I've been here 30 years. Absolutely wonderful staff here. Thank you to the board. I mean, without the support of you guys and backing our programs, things like that, we wouldn't have the wonderful community services, senior services that we do have. This lady is amazing. She is like a wonderful cheerleader. She has come out on, she's been in our hospitals. She's shadowed with our case managers. She's seen what we do. She understands what we do. Without her support, we truly could not do what we do. So we really do appreciate everything that you do for us.
But you today.
I know. It's wonderful. So, and obviously to Natasha, her and I job shared for a number of years. So, we are extremely close and, just mean the world to me. My managers, the other managers, you guys are just, can't say enough about you guys, especially during COVID when we were all ready to pull our hair out. You guys were wonderful. To my Choices team, you guys I inherited the best team. My gosh, they're just so wonderful and they support one another. They help each other out. And, it's difficult because we have to cover the hospitals, so they can't take days off like the rest of us can. We cover holidays, we cover the day before Christmas, we cover, things like that when, other staff are off. And so my team is truly dedicated and I just, want to thank them for all their hard work. So thank you. I can't believe it's been 30 years.
Perfect picture. I'd like to open it up to the committee. If anybody have any comments or?
Congratulations.
Thank you.
This is wonderful.
Thank you.
And you must have started when you were 15.
I did.
I was gonna say 13, but
That was my first
Always
job out
one
of
of
college.
yeah.
First job.
Wow.
When you take your first job, you never realize like, oh, I'm gonna actually still be here.
It's amazing. Amazing. Congratulations. Thank you.
I just think, it's so great to see how you adore your management team and how your staff is here to support you. It's wonderful. So thank you to everybody putting this, cohesive team together.
And 30 years is a really long time. It really is. But it shows your passion for, for what you do, and especially, and it's not easy. Taking care of anybody is not easy, and you've been doing it for 30 years. So thank you from the county board. Thank you very much.
Thank you.
So we're gonna get a picture with Jeannie and staff and our county board members. We'll stand over here and.
Let's look at the picture.
My mother used to do that all the time.
Sheila, you can get in this.
Okay.
Yeah.
Yeah, it's absolutely.
Such nice things said about
And then you're Paula. Are you able to get us all in, Karen?
Karen, you're probably gonna wanna turn the other way.
I will, I'm gonna do both. Oops, I'm sorry. Okay. Your best smiles. I got the garbage can in there. Okay.
Congratulations.
Thank
Reach out if
you.
ever need anything.
Oh, thank
Very
you so
grateful for
much.
your-
Thank you.
Sure.
Whole nother 30 years somewhere.
Thank you to all the employees who are in here. You don't have to stay for the rest of the meeting if you don't want. You're welcome to.
Oh, Lord.
Okay. We're moving on to item number 7. I'll take a motion to approve item FIR 27223, acceptance and appropriation of the Low Income Home Energy Assistance Program, HHS grant, plan year 24, in the amount of $2,948,471. We have a motion, a second. Questions or comments? All in favor, say aye.
Aye.
Opposed? Take a motion to approve item HSR 6923, approval of issuance of payments by DuPage County to energy assistance providers through the Low Income Home Energy Assistance Program, HHS grant plan year 24, in the amount of $2,408,901. We have a motion, a second. Questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve item HSP 8823, awarding resolution to WellSky Corporation for the renewal of the Homeless Management Information System Software and Cloud Services Contract, renewal of licenses, training, support, and custom programming for community service for a contract total amount of $43,720.48. We have a motion and a second. Questions or comments?
For the record, remember Julie's right.
Gotcha, thank you. All in favor, say aye.
Aye.
Opposed? Thank you. On to our DuPage Care Center, agenda items. I'll take a motion to approve HSP 8923. Recommendation for the approval of a contract purchase order to Airgas USA LLC to furnish and deliver liquid portable oxygen for the residents at the DuPage Care Center for the period December 1st of 23 through November 30th of 24, for a contract total amount not to exceed $48,000. We have a motion and a second. Questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion to approve HSP 9023. Recommendation for the approval of a contract purchase order to Accelerated Care Plus for leasing physical therapy equipment for the period January 1st, 24 through December 31st, 27, for an amount not to exceed $35,859.36. Any questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion to approve item 233743 HSP 51A-23, amendment to resolution HSP 5123, issued to Performance Food Service for secondary food supplies and chemicals for the DuPage Care Center for the period March 1st of 23 through February 29th of 24, to increase encumbrance in the amount of $20,000, 27.45% increase. Any questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. On the budget transfers, I'll take a motion to approve item 233744, budget transfer to transfer monies from the wearing apparel account to the equipment and machinery account in nursing services to allow for the purchase of a replacement of a Broda shower chair for the residents of DuPage Care Center in the amount of $1,935. We have a motion and a second. Questions or comments? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion to approve item 233745, a budget transfer to transfer monies from the dining services account to the housekeeping account to allow for the purchase of 2 Dual R Micro Plus Pro mops to add to the current fleet for newly purchased housekeeping trolley cart at the DuPage Care Center in the amount of $1,400. Did we get a motion?
Second.
Okay, questions or comments? Yes.
What kind of
of mop is this? So it's two of them $1,400.
Janelle is smiling on the screen.
It's a specialty mop. I don't have all the details on it, but we got new trolley carts and this is a whole mop system. So it alleviates the need from, they have to change mops every room. They have to change mops from dirty clean. So this whole system helps with that process and makes it more efficient,
Can I borrow it?
I'm just saying.
right?
Right.
The mop, the sorcerer's apprentice.
Something, yeah.
Yeah, exactly, that's the one.
Makes sense. Thank you, Janelle.
Thank you. Any other questions? All in favor, say aye.
Aye.
Opposed? Okay, thank you. Janelle, we don't have any residency waivers, so on to our DuPage Care Center update, please.
All right. So from a COVID perspective, the care center is on outbreak. We have one unit that's finishing up some quarantine. We do notice that the community hospital COVID admissions in Illinois counties are on the rise. However, DuPage is still low. We are putting messaging out to our residents, families. If they're doing large group gatherings with the residents, please be cognizant and if at all possible, wear masks because we always see an uptick after holiday events. So we're prepared for that. The next meeting with the Health and Human Services on December 5th, I'm going to be bringing a slideshow so you can see the renovations that are well underway. It's really exciting to go up there and see all the things that are being done. And in the next couple of weeks, we expect that the resident room cabinetry will be installed. So I will be able to bring those pictures and you can see the bathroom and wall flooring and the hallway flooring. It's just remarkable. I'm so excited. It looks like a whole nother building. So I'll be bringing you some pictures at the next meeting to share with you.
Okay,
And then-
great. That sounds
Yep,
great.
and then the last thing is that we have completed all of our annual surveys for both health and life safety code. And they both went well and we've submitted everything and we've received our clearance that everything is in order. So that's nice to get that out of the way for the year.
Very good. Thank you.
Thank
Paula?
you.
Yeah, quick question, in terms of vaccinations for all of the residents, have they, most of them got the most updated COVID-19?
It's funny you should mention that. So the pharmacy is here today doing the resident vaccines.
Oh, okay, perfect.
Yep.
Right.
Any other questions for Janelle? Member Childress?
Will you be receiving a plaque or something for the award that you won?
Actually, there's a whole marketing thing that you can access. We're not allowed to use the US News and World emblems on our marketing materials without some licensing fees. So I'm working on obtaining that and a plaque would come with that. Yes.
Any other questions for Janelle? Thank you and congratulations again.
Thank you.
That's so wonderful.
Yep. Thank you. Thank you.
On to community services update, Mary Keating.
Well, we didn't get any national awards.
Not yet, not
Congratulations, Janelle. I mean,
Thank you.
we're just incredibly proud of the work that's done over there. I had just one quick thing and then something else that popped up in the conversation this morning. So just a reminder, the equipment grant application is still open for food pantries. I think it closes on the 16th of December, 14th, sometime in mid-December. But we'll get a reminder out to food pantries. Finance staff is a little skeptical because they haven't gotten a lot of applications in. I have told them that in my experience, people submit about 48 hours before the deadline. So that's when they really start rolling it. So, but we'll let you know what comes in after that close date. And then, so this morning, I wasn't planning on talking about this, but this morning, Jeannie and Natasha both referenced that they were in a job share. They were both in different job shares for a long period of time. For a long time under county policy, we had a great job share program. It was not two part-time people. It was two people doing the same job. It required kind of special kind of people who could really work like really hand in hand with one another. It required a lot of accountability, a lot of communication. But when it was done well, it was really, it was incredibly helpful in keeping employees, particularly, you know, as Jeannie said, she had young kids. she was able to work part-time. The nice thing was that they got full-time benefits. And so I think, you know, the job share program was changed 6 or 7 years ago. It's been a while. And so the employees don't have access to that anymore. So it's just not as, it's not as appealing. But I would, you know, I don't know if there's ever an opportunity to kind of look at that again. But I will say particularly in the seniors unit, we have a lot of young folks early in their career and early in starting families. And so oftentimes they would, you know, they would welcome the opportunity to work, to, you know, to reduce their hours, but the benefits are, you know, are not there if they're part-time. So I just kind of wanted to put a plug in for something that we used to do. Like I said, I know in some departments, they had some challenges with sort of job share, but you know, there wasn't that, the idea behind a job share was if I reached out to the administrator of senior services, it didn't matter if it was Mary Lee or Mary Persing, or that they were the people, like they had just had a seamless transition, and Natasha did as well when she was in her job share in, was it Choices or Ombudsman? Yeah. You know, so, and from clients' perspective, it was just seamless. So anyway, they both mentioned it this morning, so I thought I'd talk about it. There's some hands raised.
Yeah.
Maybe do you recall why the job sharing thing ended?
I don't. I recall advocating that it was really helpful for us.
Sounds wonderful, wonderful, especially for.
And yeah, there's a new definition under, I think that my guess is it was a issue with the cost of the benefits, but I don't know that.
I think the cost of the benefits outweighs the cost of hiring a new person
I
or
don't
bringing in new
disagree with
people, training new people.
Right.
So I'm all for it.
I just
yeah.
think if there's a time that we're looking at, you know, at HR policies, I'd love, you know, the ability to give people flexibility is, it's really important. And particularly with the incredibly competitive job market and employees wanting as much
Well,
flexibility.
especially now that we're talking more and more about work-life
balance. sure.
balance.
Yeah.
It seems like it would be.
And the cost of childcare is
Oh,
insane, if you can find it.
yeah.
And
So-
onboarding women back into the workforce
Mhm.
is quite cost prohibitive, as we know. So this would help keep
Yeah.
women.
Yeah, anything we can do to
parents-
keep staff on is
Right,
really helpful.
exactly.
Yeah, I mean, I was gonna just reiterate some of the things that were just said. I mean, I attended all 3 of the seminars that Lisa Shabak did for the back to school, back to work, and that comment came up time and time again. There's so many talented people who've been, I mean, it was primarily women at these seminars, but not I mean, also men who've been home taking care of either children or aging parents.
Mhm.
And, you know, the need for flexibility was the #1 concern.
Right.
And, you know, Lisa was trying to pair with organizations in DuPage that were family friendly, but I think we're in a very different job market now than we were 6 or 7 years ago, for
Absolutely.
whatever that reason was that policy was changed. I
Right.
think we definitely should revisit that, because I do for sure agree that it's way more expensive to try to find good employees and to
Well,
retain good
Right,
employees.
and you know, a lot of our jobs, they're hands-on with clients. They can't be done remotely. So a lot of employers are competing by like, oh, it's 100% remote.
Yeah.
We're going into clients' homes, we're in the hospitals, like we're face to face. And so we don't have the ability to provide that level of flexibility that people are looking for. It would be nice to have something else that's appealing.
So Mary, who would be in charge of revisiting that policy?
I would assume that would be Margaret. The finance committee actually is the parent committee to human resources. I haven't mentioned this to Margaret, so like I said, it came up this morning and I was like, you know, they referenced it a couple times. I think it's worth letting you know something
So
that.
talk to Liz, the finance chair, to get it on the agenda. Is that your recommendation?
I'm not making a recommendation. I'm just telling you something we used to have that was really great. So I'm just providing follow-up information to something that came up at the presentation.
Very good. Very good. Thank you. Any other questions for Mary? Thank you very much. Really
Okay.
Appreciate it.
Thank you.
Do we have any old business? I have some old business, so. First of all, thank you, everybody, for your support for our small business grants. You, and our presentation last week went really wonderful. And I'm really saying this because I need to thank finance for the wonderful work that you guys did and the hard work and the pain in the rear work that you guys did.
Yes, it was a lot, thank
it was
you.
Very, very much appreciated. And you could see, I hope you guys, if you weren't at the meeting, I can't remember if you were at the meeting or not, but hopefully you saw the recipients when we were doing the pictures in the room next door and their joy of receiving these grants. With that being said, it's on our the budget agenda that we'll be voting on next meeting to include 3 more years of this. Assuming that it gets approved next meeting, Vice Chair Garcia and I, along with Finance Chair and Vice Chair Chaplin and Krajewski, Finance, Community Services, and our ASA will be meeting probably in January to sort of iron out some of the issues that we had this year. Hopefully make it a little bit easier for everybody next year. So
Can
Yes.
we have input into that too?
I absolutely. My suggestion would be send me your concerns, send me Paula your concerns, your recommendations or whatever, and we'll definitely bring that up as part of our conversation.
Yeah, I just would love to add, and I'm sure Lucy would agree with me, like, it kind of pained me that we didn't give out all of our money because we didn't have enough applicants. So maybe if we are, I know it's a growing process and, learning curve, but like if we could have a little more time to advertise it and get the press release
We
out.
can
once
do
it's approved.
whatever we want. I mean, for the most part, legally wise, we have to, and finance wise, we have to make sure we do things right.
Yeah, 'cause
Yes.
I know we
But-
both worked hard to find more applicants and it.
And District 6 was in the same boat.
Yeah,
I mean, we
yeah.
didn't- So, I mean, District 4 and 5, you
Oh
guys
my
are in your
God.
own.
Oh my
You
gosh.
guys have your own.
It was
issues.
amazing.
But yes, we're not gonna ram, I mean, we didn't have as much time last year because we needed to get it in, but now we have some time. We'll make sure we hopefully do it better, if not, it may not be perfect, but we'll certainly do it better. So, but yes, give feedback to me. You can include Paula and you can include staff in if you want as well. So, but please send it to me.
Yep.
Thank you. And then also on next week's agenda, I wanted to thank everyone on this committee for supporting the extra $1.14 million out of ARPA interest going toward food next year. Very appreciative that the chair included 1.5 million. Though in 2023, we spent close to probably a little bit over $4 million in food and people are still going hungry. So that would increase the 1.5 to 2.64 million, which is definitely needed. So I'm hoping everyone will vote, be on board with that next meeting.
So that opens the door to the question about, we talked about this a couple months ago, and I just want an update. Are the pantries and the food pantries getting sustainable produce now, or are we still hearing any issues
We have
about
not, no.
spoiled produce?
Yes,
I just
no,
want to make
we
sure.
have, I mean, I have not heard one complaint
Okay,
since
good.
we took.
Just making sure.
Two of those
and
townships
there's a
out.
couple pantries that continue to communicate with me of how great it is.
Oh,
So-
good.
And in all honesty, it was only 2 pantries who ever raised the concern out of the 22 that are receiving produce.
Good to know. I just hadn't heard an update for a while. I wanted to check.
Thanks for
Thank
bringing
you.
that up. So, yeah. And we will, assuming the budget passes, we will be in conversation with this committee on how to spend that 2.6 million or 2.6 million. So, thank you. Do we have any new business? Seeing none, I'll take a motion to adjourn.
Second.
All in favor, say aye.
Aye.
Thank you very much.
Happy Thanksgiving.
Yeah, all happy Thanksgiving.